Welcome back, everyone. Joining us now is Nicholas Allgood with Grand Mental Health to talk about new facilities that are either under construction or newly opened. And so let's just start with the one that opened in December and go forward from there.
So we opened our Tulsa Urgent Recovery Center on the 29th of December in Tulsa, on the former campus of 12 and 12.
And what makes this different?
So the Urgent Recovery Center is a 24/7 access point to all forms of mental health and substance abuse care. So it's the first of its kind where both substance abuse and mental health have an entry point that's open all day and all night.
And so those have been divided and hard for people to find services, and the lines are so blurred. People can have both going on, so this really helps them get in.
So historically, those systems have been pretty divided, and this allows them to be together and to create one entry point versus the multiple areas of entry that kind of slow people down and create barriers.
So you said December 29th. It hasn't been that long, but what kind of impact have you seen?
Yeah, it hasn't been that long, but we've admitted over 1,000 people through in those months.
So you've seen an impact already.
We've seen a significant impact. Most of those, probably around 85%, have been going into some other form of treatment, either outpatient treatment or residential treatment for substance use. So pretty significant impact.
And so the other facility is coming in Claremore.
Yes, so we have a family treatment center opening in Claremore, and that is going to be for children and their families that are experiencing a crisis. It's kind of an attempt to keep children out of the inpatient hospitalization setting, to divert those inpatient admissions and treat them at a lower level of care.
Mental health is such an interesting subject because it has changed so much over generations. And then, of course, the pandemic had such a drastic impact. What have you seen change since 2020?
Yeah, I think people talk about mental health a lot more now. They're a lot more open about discussing it. I think that the barriers to access happen in different ways now. So there's a generation that wants to be present in a tech world, but not necessarily come in person. And so it's changed the way those services are provided and accessed. And then also being able to have 24/7 access has some negative to it as well, where you're constantly getting feedback from peers that may not be positive. And so mental health has an impact, both good and bad, from COVID.
And generationally, there had been a stigma with our earlier generations. You didn't talk about it. Now, as you said, we can talk about it, and yet the incidence of mental health issues and suicide in Generation Z is higher than the others. Why, if there's more access, how do we get to them?
Yeah, I think we have to engage them differently. So I think that that's the key. Is in a lot of contexts, we've tried to engage the Generation Z with the same tools we were using for generations previous. And we have to change that. We have to change how we communicate with the new generation and how we get a hold of them and let them know that help is here.
But I would imagine there are some confidentiality issues with that, and so you have to navigate the tech world as well as the health world.
Yeah.
What has been the biggest challenge in bridging that gap?
I think making sure that those evidence-based practices you use work in that technology environment. So making sure that those same techniques translate to the youth. And then also keeping and making sure confidentiality exists and that parents and families are involved, because we know when a family is involved, the outcomes are better. And so how do we integrate all those systems together? And I think that's what we're trying to figure out, and I think that's why you see that delay. We kind of thought we had it figured out, and then through COVID and the use of the internet and some other tools, that's kind of changed, and we have to catch up as a field.
Well, and it's a moving target.
Yes.
The minute you catch up, the goalpost keeps going, right?
That's right.
So what's next?
I think we have to figure out how to meet people where they're at. So we have to find out what this generation, where they're collecting as a unit, and then attempt to meet them where they're at. So whether that be their houses, over technology, in person, whatever the site is, we have to meet them and be there and be supportive and let them know. And I think 988, the rollout of 988 nationwide has been really helpful in that. There's a text line that people use more than you would have thought. And so, especially with this new generation. So continuing to develop tools like that, I think is going to be critical.
The anonymity of the internet, where people might say things they wouldn't to your face, could have a positive impact.
It definitely could, yes.
So you run into that with texting, and that, how do you make sure that you're reaching people?
Yeah, and I think that's exactly it. We're just being present. It's a lot of the same techniques, it's just using them differently. So before, somebody would have come in, like they come into a doctor's office and sought that treatment, and now we're having to find them where they're at. And that's through the texting, through the anonymity of that, there's a comfort, a psychological safety in that. And so we're making sure that we're meeting them where that's at.
And I saw a billboard, and I believe it said you're hiring.
Yes.
So is the demand for people to assist as high as the need for services?
Yes, I think the demand may be higher because we're in a place in Oklahoma where we have a shortage of providers, both mental health counselors, psychiatrists, nurses. So meeting the demand that is now present with those generations that are seeking the treatment in higher numbers has been difficult. And so we're working on that as well, because you've got to have the resources in place in order to meet the demand.
Mm-hmm. So what kind of employees are you looking for?
Yeah, we're looking for employees that have mental health experience or have a passion in working with mental health. We're looking for nurses. We're looking for anybody who really has wanted to work in the mental health and substance use field. There's a role for you, and I encourage them to seek out those roles. And I think historically, people have gravitated away from that. And I think now there's a lot of changes that have come through the certified community behavioral health centers that have allowed employees to have a better financial incentive to work there, that they have better health insurance packages, which is important in making sure that those unmet needs of the clients are met.
Well, mental health services had not been covered by so many insurance plans for so long, and it's just starting. So that alone has to be a real barrier.
Yes, absolutely. I think that that's something that the state and the Department of Mental Health have really been working hard on helping with, as well as how do we engage the employees to be able to be available for the clients we need to serve.
Okay. Thank you for coming in, talking about a very important topic.
Thank you.
And something that, of course, is very important on a college campus with that younger generation.
Yeah, I appreciate it.
Thanks so much.
Thank you.
And we will be back in just a moment.